afternoon to recognize the presence of the Honorable Minister for Health, Wellness and New Health Investment, Dr. Irvin McIntyre, the Permanent Secretary within the Ministry of Health, Wellness and New Health Investment, Mrs. Letitia Lestrade-Wyke. We also have with us the Director of Primary Healthcare Services Acting, Dr. Lenora Favrier-Drygo, the Coordinator of the Health Promotion Unit, Mrs. Mignon Rule Shillingford. Also with us, we have various heads of department and staff within the Ministry of Health. We welcome our media partners and, of course, you, the listening and viewing public. Welcome to the official launch of Caribbean Wellness Month. As you may have noticed over the years, within this ministry, it's never just Caribbean Wellness Day. We spend an entire month dedicated to Caribbean wellness, and this year is no exception. One of the mantras of the ministry is your health is your responsibility. However, you notice that the theme for Caribbean Wellness Day, Caribbean Wellness Month, is power through collective action, our neighborhood, our health. And the reason being that within this ministry, we've adopted this theme simply because we understand the importance of collaborative effort. And during COVID-19, that became even more paramount, working together to ensure the health of the general public. So that's why, although we believe it's your responsibility, we also believe that everyone needs someone to keep them accountable. So it's our neighborhood, our health, our theme for this year. And we'll begin the proceedings this afternoon with a prayer by Mrs. Adora Toussaint, who's a health educator within the health promotion. Please stand, everyone.
Thank you. Let's pray. There is sunshine in our soul sky, for Jesus is our light. And so this afternoon, dear God, we come before your presence in the beauty of holiness. We thank you for taking us from our offices, our workstation, and bringing us here today as we launch Caribbean Wellness Day, a day which reminds us of the opportunity, Dominica. We know, Heavenly Father, you have said in your words, a merry heart doeth good like a medicine. And when we are merry, we are happy, we are youthful, we are joyful, we are doing the things that you want us to do, our hearts are glad. You also said in your words, oh God, whatsoever we do, whatsoever we eat or drink, will bring glory to you because it is within ourselves. I am glad to this island, which is, oh Lord, the sunshine of our soul. Thank you for being here this afternoon. For this we ask in no other name, but in Jesus' name with thanksgiving. Amen and amen.
Amen. Thank you so much, Mrs. Toussaint, for inviting the Holy Spirit and our Lord amongst us. And again, like she said in her prayer, it's collaborative. We not just collaborative with each other, but we collaborate with God. We let God intercede. And
what is affecting us most in this country and the region, NCDs. So, where did all of this happen? How did all of this Caribbean Wellness Day happen, and how did we start celebrating a day? So let's just take you back a little bit, because it has been 2 years since we have been able to do this type of activity and focus on our NCDs. So in 2007, there was a Heads of CARICOM meeting in Port of Spain, Trinidad. And the biggest agenda on this meeting was, what is it that we can do as a region, as member states, to address this endemic of NCDs? And I will be using NCDs a number of times, and just to, as a recap, and just to make you remember, those who may not remember, what are these NCDs we talk about? So we have things like diabetes, and we know diabetes is, we call it sugar, when you're sugar high sugar in your body. We talk about cardiovascular diseases, and when we talk about that, things associated with the heart. So the stroke, the heart disease. We talk about respiratory to do with your lungs, bronchitis, the asthma. That is what we talk about. Thank you. And we talk about cancers. So all of the different cancers that plague the population, breast cancer, prostate cancer, cervical cancer, colon cancers. And there's another one we speak of, and a lot of time we seem to forget about it and not give much focus to it. And today I want to say that we will be committing to focusing more on that, and that is mental health. Because the mind controls our body and controls every activity that we do, including management of all of our other NCDs. So on this day, the heads of CARICOM met and they decided that we needed to unite. We need to unite. One country, one member state cannot do it alone. So we need to have a collective body to fight this epidemic. And from there, they decided in 2007 that they was going to recognize a day that every single Caribbean country would observe as Caribbean Wellness Day. And on that day, they would focus on raising awareness of the NCDs I spoke about and giving people empowerment and skills to take care or to help with these NCDs. It was identified that from 2008 that it will be held the second Saturday of September every year. So Caribbean Wellness Day is on this year, the 10th of September. So Dominica, along with the rest of the member states, began observing Caribbean Wellness Day from 2008. It started with the celebration of a day, and that day was celebrated for only 1 year. By the second year, Dominica began celebrating for a week, and after 2 years, Dominica started celebrating and observing for an entire month. Okay, because of course we understood the significant and the important role that this type of activities in raising awareness played. So from 2011, Dominica had been observing a whole month of activities. Now, when we talk of NCDs, it's always nice to remind our population or to empower them of the impact that these NCDs are having on the region and of Dominica. So regionally in the Caribbean, NCDs are the leading cause of death and disabilities, and 76.8% of the total deaths in the Caribbean are from the NCDs. When it comes to cardiovascular diseases, meaning those associated with the heart, as I said, heart attacks, and so 30.8% of that 76% cardiovascular disease. Cancers, 17.2%, and diabetes, 10.8%. Let's look at and what is the leading cause of death. Because before that meeting in 2007, when we looked at the data of why is it that the people of Dominica were dying, a number of the things were things that what we call communicable diseases, things they got from infections, like TB and other respiratory conditions, polio. But right now, almost 90% of the things that kill Dominican most are NCDs. And we refer to NCDs as modifiable. Big word, simple meaning. We can prevent it or delay its onset. So we do not have to get cancer and die. We do not have to get diabetes. We do not have to get high blood pressure. We do not have to get respiratory conditions. All of this can be avoided by improving our risk factors. And what are our risk factors? The good old topic we don't like talking about, alcohol consumption, the population, tobacco smoke and secondhand smoke. Tobacco smoke and tobacco that not only affects the individual who is smoking, but also affects all persons receiving secondhand smoke. So you affect yourself, the impact is on yourself, and also on all persons that are receiving secondhand smoke. And the impacts are just the same. Cancers, diabetes, high blood pressure, and all of them. The other one of course, is physical inactivity. So we are not engaging in activities. A number of us, we sit at our desks because that is what our work, and of course, eating unhealthy diets, what we are putting in our mouth. So when we look at the 10 leading causes of death in Dominica, and that for the period 2017-2021, the first one we have cerebrovascular disease, which is CVA, stroke. Okay, stroke. And that is a result of a number of things, high blood pressure, and even the alcohol we drink and we drugs and how we eat and fat build up. So stroke is the number one. Heart disease, diabetes. People are dying from diabetes. Then high blood pressure, number 4. Acute respiratory infections, number 5. And you know, for 2021 to 22, we had a new infection. Other things like anemia, obesity disorders, eye disease. Then number 7, we have prostate cancer. Okay, and that's our men. Then we have heart disease, and then the final one is other communicable disease, things like leptospirosis. Health. That means it's everybody's business. We at the hospital, but where you play, where you recreate, where you worship, and where you work. And this is the areas we want you to give part in terms of your activities. So just to recap, Caribbean Wellness Day theme this year is our neighborhood, our health. It is observed the day is of this. All of this is to raise awareness and to catapult what is for action in fighting NCDs. Thank you very much.
Unit, Mrs. Mignon Rose Shillingford. Of course, you'll be hearing and seeing a lot of the Health Promotion Unit over the next month or so. So thank you again to Health Promotion for your continued work.
Good afternoon to Minister Edwards, Yes Wyke, my colleague and friend of the Ministry of Health, the media team. You are so important to us. Thanks for braving the weather and neighborhood or health. WHO defines health as a state of complete fitness of disease or infirmity. Therefore, I think it noteworthy to appreciate the change from being called just the Ministry of Health to the Ministry of Health and Wellness. Good afternoon, as a proud representative of the group of phenomenal healthcare workers who are tasked with the job of ensuring that the needs of the population are met at the most essential level, and that is primary healthcare services. So you can clap for primary healthcare services. The World Health Organization adopted the primary healthcare approach of effective delivery of healthcare services, and some might venture to say the most important aspect of healthcare. No child goes to college before going to primary school. The primary healthcare approach is both a philosophy of health and health promotion unit. It is preventative and supportive. And the principles of primary healthcare are accessibility. So you will find that we have had over the years a drive to improve our healthcare facilities, and the government of Dominica has seen it fit with new state-of-the-art, beautiful buildings that we can work comfortably in. When before we had not comfortable to working, right now we're working in clean, beautiful environments that our clients enjoy coming to. And the primary healthcare approach is accessibility, like I said, public participation, the nurses and the doctors. This brings me Caribbean Wellness Day, or Caribbean Wellness Month in Dominica, is and as we like to say at the clinics, we take care of you from the cradle to the grave, providing services such as maternal and child health, antenatal care, school health, vaccination, non-communicable disease clinics, comprehensive clinics. We do household visits. There's a long list of things that we do. We do home visits for our shut-ins and our elderlies. We do diabetic foot care. We do diabetic retinopathy care for our diabetic patients. We do cancer screening like prostate screening. We do breast examinations. We do pap smears. We do catheter treatment who can no longer urinate the conventional way. And most recently, we have added an endocrinologist to our team who has taken up the task of doing one-on-one consultations with our patients presenting with diabetes, thyroid issues, polycystic ovarian syndrome, dyslipidemia, infertility issues, hormonal disorders, and obesity. So we actually have this in primary health care in Dominica. Studies presented in the month of May pointed to Caribbean countries as having some of the highest rates of obesity in children in the world. In fact, 1 in 3 and 1 in 5 of our adolescents are either overweight or obese. This is mainly due to poor dietary intake and low levels of physical activity. Particularly worrying are the low levels of consumption of fruits and vegetables. Imagine living on an island where all of this is in abundance, and every time your child asks for a snack, you give them a bag of crisps or chips instead of a mango, or tell them go pick a guava. And high levels of consumption of carbonated beverages, and these are found in our schools. This is not only a matter of individual choice, but a matter of environments that promote obesity. For example, the easy availability of high-fat, salt, and sugar in our foods, the heavy advertising of junk food to our children, and a high level of screen time watching television and video games. This year, primary healthcare services in Dominica will focus on community outreach, which includes outreach in our schools, all in an effort to propel you on the fishing dock when you pull in your nets. It's okay, we'll wait on you, we'll check your pressure there. We're doing prostate screening, we're doing breast screening. We're going on the block and we're checking the young men standing there smoking, and we will be doing all of that, all in an effort to ensure that Waitukubuli and its population remains safe and healthy. Thanks for listening.
Services, Dr. Lenora Favrier-Drygo. Of course, primary healthcare services, as I mentioned before, will be playing an integral role in this role in every single campaign that has been put forward by the ministry. So, Dr. Drygo, let me thank you and your team for your continued dedicated service. Of course, we cannot launch Caribbean Wellness Month without the presence of the person who steers the ship that is our own Ministry of Health, Wellness, and New Health, Dr. Irvin McIntyre.
Thank you very much, Ms. Harry. Let me recognize Honorable Kent Edwards, our Parliamentary Secretary in the Ministry of Health, Wellness, and New Health Investment, our Permanent Secretary, Mrs. Letitia Lestrade-Wyke, our Acting Director of Primary Healthcare, Mrs. Nora Favrier-Drygo, our Coordinator of Health Promotion Unit, Mrs. Bignon Roll, the heads of departments, staff of the Ministry of Health, the media, the viewing and listening public. It is my pleasure to be here today at the launch of the Caribbean Wellness Month. As you heard in September, it's gone to a week, and now it's actually, which makes better sense in the sense that we have a month to carry out all these activities. And you heard the overall theme, which is power through collective action, and our sub-theme, which is our neighborhood, our health. So many things have gone on in terms of primary health care and the chronic non-communicable diseases. And just to mention a few of them that you might be aware of, but for instance, we had to sign on to FCTC, which is the Framework Convention of Tobacco Control in 2006. And that included the education, communication, training, and public awareness campaign in line with Article 12 held yearly. Apart from that, we increased 10% taxation on tobacco and tobacco products mentioned as the Framework Convention of Tobacco Control. We also had the drafting instructions done with assistance from PAHO and the regulations being drafted and complete legislation to be done. But that's regarding tobacco and tobacco products. But also, let alone this in action, that is the difference with the 9 global targets, element to 9 global. NCD Commission, a chair from the civil society would be there as well. The commission focused on childhood obesity. Now that's 23% of children between the age of 13 to 17 are overweight. And these numbers, these are significant numbers, also recognizing that less than a quarter of our children are engaged in at least an hour of physical activity a day. And more than 50% of our children are engaged in sedentary activity, which is maybe just sitting down or lying down, watching TV, playing video games on the telephone. So more than 50% of kids do more than 3 hours of that per day. So all that leads to inactivity, and inactivity ends up leading to obesity, and we know obesity eventually leads to chronic non-communicable diseases. Apart from this, we've also developed an adolescent youth policy and active aging policy, which was completed in 2017. We had the drafting of the alcohol policy as well, the development of a school nutrition policy, which we have handed over to the Ministry of Education for the implementation, which is what's going to handle our obesity and inactivity in our school children, which is basically a preventable diseases. Also, we had the Implementers Wellness Program, and this year it was revamped. You must have seen many public officers or heard many public officers going to exercise this program. It started more than a month ago, but we've revamped it, and then we're going to continue that, and all that is going to lead into our bigger program for the management, for the prevention and management of chronic non-communicable diseases. We also had the implementation of standard disease for the self-management program, where we the tools, that is the skills, to help those with chronic non-communicable disease manage their own conditions. And then apart from this, we had also the free medical care to people over 60 and to those under 18 years. And then also we have the monthly allowance to elderly, 70 years and above, the social determinants of health. So whether it's the NEP program, whether it's proper housing, whether it's a water sector, and you have to look at things. For instance, in Dominica, we have 98% coverage of pipe-borne water. There are certain Caribbean countries that 50% of the rural area, there's no pipe-borne water. And then you look at the housing program we have, so it's better housing conditions, all this is. When you look at the NEP program, which is the socio-economic aspect, we're dealing with all the people. And also in terms of road safety, we have maybe the best road surfaces in the OECS. Not maybe, we do actually have the best road surface in the OECS. What this does is basically protected us from accidents. These are non-communicable. And then also in terms of getting us access to our health centers, etc. So all these social determinants of health do handling the chronic non-communicable diseases. Apart from that, we also have the increase in human resource for health. This we've been dealing with very aggressively in the sense that we know about the situation with nursing migration. So with our Dominica State College and the free health, the free tuition, as well as with our All Saints University, that we can produce more nurses, which is basically the only way that we can really handle this nursing migration. It was discussed in Geneva recently, the World Health Assembly, and Dr. Tedros, Director of the World Health Organization. The only solution to us developing countries is that we just have to graduate more nurses, which is what we're in the process of doing. In terms of specialists, obviously we keep training more specialists because we need specialists to help us handle all these chronic non-communicable diseases. That is why we actually have our endocrinologist, which is involved in both the primary healthcare and the Dominica China Friendship Hospital. So that, and we know diabetes is endocrine related, so that's where we get the help. And lots of other specialists, whether it's the eye spot, because we have to deal with diabetic retinopathy and all the other different aspects related to chronic non-communicable. So if we have all these cardiologists to help us with all the cardiovascular issues related to non-communicable diseases. Apart from that, also the National Health Insurance Scheme, well, that policy ensures healthcare service to all residents of Dominica, and also a budgetary allocation of an additional $5 million for cancer treatment. You would agree that all these policy actions undertaken by the government of Dominica are critical strategies in combating this NCD's epidemic and in line goals, initiatives that will transform the world by 2030. To highlight a few of the goals, that is to end poverty in all its forms everywhere. We also to end hunger, achieve food security, and improve nutrition and promote sustainable agriculture as well. To reduce inequality within our cities and human settlements, inclusive, safe, resilient, and sustainable. Also to ensure sustainable consumption and production patterns. We will come to the part of eating what we grow and growing what we eat, which is also part of the dietary discretion related to chronic non-communicable diseases. We also have to promote sustained, inclusive, and sustainable economic growth, full and productive employment, and decent work for all, which is what I mentioned earlier as regards to the socioeconomic and the social determinants of health, etc. Also to build resilient infrastructure, promote inclusive and sustainable industrialization, and foster innovation. Promote peaceful and inclusive societies for sustainable development, provide access to justice for all, and build effective, accountable, and inclusive institutions at all levels. Also, to strengthen the means of implementation and revitalize the global partnership for sustainable development. In terms of, these were the things that the government has been involved in, the different policy measures that we have taken and all the legislative action that we have taken. But presently, there are other things ongoing, and these are just a few of the I would like to mention to you. First of all, for this to happen, there must be commitment by the government of Dominica and the Ministry of Health on NCDs. And from that point of view, we're not lacking. If anything, we're in a very good position as regards to our political will to deal with chronic non-communicable diseases. And we signed to various regional and international health commitments to combat the NCD pandemic, the Framework Convention on Tobacco Control, which I mentioned earlier in 2006, and in terms of tobacco smoke and secondhand smoke, the regulation for smoke-free spaces, taxation, labeling, and marketing and advertisement as well. Also, we have to consider the Sustainable Development Goals, which I'll refer to later. But presently, what's being done is you have to look at the policy development and direction, the strategies to improve primary, secondary, and tertiary healthcare for all persons to achieve universal health coverage. So this is why the government has invested significantly in our health infrastructure. We've built 12 centers, and we're in the process of building 3 more. Well, actually, Savant-Pai has started already, and then we are going to do the St. Joseph Health and Wellness Center, as well as the Roseau Health and Wellness Center. And these 2 will be designed, well, the design plans we have is to have a very, well, not only elaborate, but an extensive wellness aspect, a wellness component attached to these health and wellness centers that will be built both in St. Joseph and in Roseau as well. Also, the Dominica China Friendship Hospital and the Marigot Hospital. Now, this comes to the curative aspect of it, but obviously we have our clinics going on there as well. And the Marigot Hospital will open in a phased manner, and it will be sort of a one-stop where you can get everything done, because we're going to employ a team approach. So whenever you go to the doctor, whether it's in the primary healthcare system or whether it's in the Marigot Hospital, whatever the case may be, there will be not just the doctor, not the nutritionist, and all the dietitians, so everyone is combined together, even environment approach to health, as we refer to it as. So in all these hospitals, the 2 hospitals that I spoke about, in terms of the equipment, that will help to manage the different complications related to chronic non-communicable diseases. If we look at it, even our HIFU machine, which is the only one in the region, that can handle the early stages of cancer. So all this is just part of the whole treatment process, but we will come later down to the preventive part and the screening part, which I will mention a little earlier on. In terms of training of the level of cardio workers, all our specialists, which I mentioned, as well as the training of the community health aides. The community health aides are really the foot soldiers. These are maybe the first line of contact between the patients or the community and the healthcare service. And we've trained 2 sets of these community health aides, and they've done an excellent job. We saw what they did during the COVID-19 pandemic, and they continue to help us quite a bit in the primary healthcare setting, and they're very important to us. In terms of requests for technical support, we can't do it alone. So we have collaborations with international organizations. For instance, maybe the most common one would be PAHO, and to help us in having the roadmap as to how we're going to progress in terms of the primary health care and our chronic non-communicable diseases. And we've identified 3 areas, our 3 main areas that we've identified. Number 1 would be the primary health care services expanded. We focus on NCDs, that's the non-communicable diseases, and other priority conditions, but get a proper definition of the expanded package of primary health care. You need to get the proper definition first before we can get on to any other activity. Hence, evaluation of the existing primary health care services, and also we're executing an analysis of the capacities of health network in Dominica and identifying the gaps for the reorganization and strengthening of the network. Also, we're in facilities in Dominica and the specification of the services delivered and human resource available. So we must define what primary health care, digital map of all our different health centers, our human resource and the services at those health centers as well. And also we've developed a proposal, a roadmap for the reorganization of primary health care services based on a revised model of care and supported by ICT. In today's world, the digital aspect must be a major part of primary health care and delivery of health services, which I will come to a little later in my discussion. Also, in terms of an electronic health records integrated, a communication and coordination of health teams supported by ICT and telemedicine upgraded referral systems. So basically what we're doing, actually we have a pilot project here, which we're doing together with PAHO, where we have 4, that is La Plaine, St. Joseph, Maho, Granby, together with the Dominica China Friendship Hospital. And these will all be interconnected, and so that information at any one of these remote centers can relate to these remote centers. So this is where the whole digitalization of that comes in. This is a pilot project we're doing together with PAHO. We've procured most of the equipment for that particular project, and it's the only one of its kind in the region so far. Well, obviously, we're going to have the World Bank sponsored, we had money from World Bank for the whole digitalization of health in the OECS. That's an $8-point-something million project. But rather than just wait for this to come in maybe next year or for it to kick in year after next, we decided let's just start. When this project does come in place, we'd be much further ahead. So it's much easier for us to get into the whole digitalization of health. And that's where it comes in. And if you want to understand, it's just like if someone were to have an X-ray done in Marigot, obviously we can have the radiologist at the Dominic China Friendship Hospital read the X-ray for us. Or if someone is in a district in La Plaine or Ulysses. So we must get all this data, all this information. This is what is going to guide us in terms of our policies onwards in terms of health. So it's not just about having information purely for the patient, get the exact impact that we want. And then, as I mentioned earlier, a team approach. And when you get to the health center, so we want to have a comprehensive approach to health where we treat every aspect of the individual's health. And obviously, the new health center, it's all about having a proper environment. We want our clients, our patients, to have a very good experience at our facilities. And obviously, I think outcome if we have a better experience. Stewardship, because, and also, that also includes the technical capacity, because, so that translates up to the hospital. Then obviously, spending is another issue, health, and the policy options for enhanced. Third, the fourth issue and the fourth app that I explained to you earlier to strengthen the information system for digital transformation for health. I'm repeating this because this is really the way to go. Besides it being tedious, it becomes difficult for us to analyze the data. And in terms of the time factor, obviously, so for instance, we have a HIFU machine here. And the HIFU machine, that all we would need for the HIFU machine, we can have a surgeon in China actually doing a surgery in Dominica. So the patient is on a bed in Dominica. All he needs is 5G. And through the internet, he can actually do the surgery, he can perform the surgery in Dominica. But it just shows you the extent and the potential for telemedicine and telehealth. So that is something good for us. And then, as I mentioned earlier, we have all the different, we've got all our servers, we have the equipment coming in, and we're really looking forward to how we can digitalize the entire health system. So from primary health care, so when the nurse meets someone, she knows everything, their the data and everything is being put into those areas. Now, in terms of lots of other programs we have, but what a lot of these programs might appear to be curative. Well, not appear, they actually may be dealing with the curative aspect of health. But if you notice all our new health, and we've added the word of wellness. Health and medicine has been a curative, we've had a curative approach. This curative approach is not sustainable. What is sustainable is for us to have early detection, and that is where screening comes in. So someone might not recognize that the HPV vaccine that we're giving to all our grade 6 students going to high school. So, and we actually have about 83% coverage in spite of COVID-19, which is pretty high, maybe one of the highest in the regions. But all of this is to deal with cervical cancer, which would come later. So all this because we know we have the asthmatics, we have bronchitis, and these are all the different things that we have to deal with. Education has to implement this program. Right, banana, it will a total change in our mindset, because that is why these are called behavioral diseases. It's our behavior. And so whether it's terms of our activity to get the kids out of the house and to go and play and just be active, whether in terms of eating healthy foods, in terms of avoiding smoking, in terms of avoiding alcohol, it's there's a lot of things put together. And obviously our mental health, which was mentioned earlier, is a very integral and important. Village groups, we need the church groups, we need the sports groups, we need all the country on a whole, because we need a productive country, and to have a productive country, we must have a healthy country. We see so many times the complications of these chronic non-communicable diseases, whether it affects the vision with diabetic retinopathy, and all the different amputations we get from diabetes, and the strokes and the heart attacks we get from diabetes and hypertension, and the amount of sick days it's causing the country, every now and then a sick leave here, and then somebody gets amputated. It's really that we expect that you welcome us with open arms, because we're bringing good news, and it's all in your interest, it's all in the interest of the country. That's where we're going to come to you. Brace yourself, September month, we have lots of activities. We are urging you to just be part of those activities, and bring your friends, bring your neighbors, spread the word around. We're already going to have a war on this chronic non-communicable disease. The war has started. And we'll be back again to sensitize you even more about our different initiatives and programs. But we're not stopping here until we get some good figures and statistics, chronic non-communicable disease. So with these few words, I really thank the listening public, and let us move on from here. We can do it, but we have to do it together. Thank you so much.
All right, thank you so much, Dr. McIntyre. I have no doubt that Dr. McIntyre will be dedicated to this drive as well. I remember just a few months ago when we had our PAHO delegates here on island, our very own PS and Dr. McIntyre advocated so strongly for a symposium on NCDs and primary health care. And even the Prime Minister was on board with that. And that's because as a ministry, as a government, they recognize the importance NCDs. We do have a couple of media partners with us, and on behalf of your colleagues, if you have any questions, you're welcome to ask them. Remember, we keep these questions succinct and we keep them focused on Caribbean Wellness Month. So if any of the media partners with us have any questions, now is the time to ask.
What activities can we expect to see for the Caribbean Wellness Month?
And I saw you almost didn't give me a chance to tell you. Eh? But I'm saying when I wrap up what the activities include, so I guess I can just do that right now. Of course, let me, before I do that, thank the very diverse cadre of stakeholders who have partnered with the ministry to have various activities throughout the month of September. We will be publishing a comprehensive calendar of activities, so look out for that on our Facebook page, on social media. But just, by way of information, we do have health walks planned. We do have screenings planned, educational sessions planned. We also have planned as well. We have cleanup campaigns planned for the month of September. We even have a day dedicated to drinking herbal tea. You know, it's all part of wellness. So there are several activities planned during the month of September. Of course, I cannot give you that exhaustive list, but look out for that calendar. We will be publishing that very soon. Now, for those stakeholders who still want to come on board to partner with us, it's not too late. Contact the Health Promotion Unit, and you know, we will partner with you whatever activity you want to hold during Caribbean Wellness.
A partnership with the Ministry of Agriculture, because I mean, it's the agriculturists, the farmers who produce the food that we are expected to eat. So will there be a collaboration between the two ministries? Thank you.
Yes, definitely we'll be collaborating with the Ministry of Agriculture. As you heard recently, the Prime Minister spoke about increasing from 300 million to 700 million our agricultural part of the GDP. And we had many, many measures in terms of, you have to look at all the different policies even within agriculture. For instance, the different loans available for agricultural activity, in terms of the duty-free on certain agricultural products, in terms of the making the land available to farmers who don't have land. And we have many all over fisheries, with the refurbishment of our fisheries, whether it's in Roseau and in Marigot. And we have many other agricultural initiatives, all geared at producing the healthy foods for the nation. So that is all part. It might not seem directly under health, but that is how it collaborates between agriculture and health, so we can produce the healthy food in sufficient quantities as well. And let alone producing healthy foods in sufficient quantities is also a matter of the economic aspect for farmers. And this is all what you talk about, the economic, the socio-economic for the social development, the social determinants of health. So everything is intertwined, whether it's the agriculture and all the different activities and the subsidies we have for the different agriculture. You see all the fertilizer that we give, and all these are subsidized, and all the land that I mentioned that we make available, all the duty free on certain things, agricultural products coming in. And we saw a certain amount in terms of the fresh juices, you saw that we gave $1 million for that as well. In terms of all the bay oils and all the different essential oils, etc., the funds available. There are many, many other things related to agriculture, which is all part of our healthy program.
Thank you very much.
You're welcome.
Sure.
And of culture them to not have access, especially at school and around the premises, of sugar sweetened beverages. It will increase and assist with the taxation that has already been in place. In terms of activities, one of them in terms of, or coordinated by the Health Promotion, Minica. So we will be in the Portsmouth, St. Joseph, Rose, La Plaine, Cassie Bruce, and Marigot Health District. We will be doing it on a large scale in terms of a town hall meeting, and our target is the entire community. So we will be doing it in town hall. So listen out for the dates in your district. One of the things we wanted to do this year, because we want to get back into health literacy, and informing and educating the public and build their efficacy in the ability to take care of themselves. That is very important. And in COVID-19, that persons do not know enough about health and what affects them. And I also want to say that while we focus and concentrate a lot on testing, but we have to also remember our most vulnerable and at-risk persons were people with NCDs. So by fighting COVID-19, we are actually fighting for NCDs, with NCDs. So please look out for that. One of the things we'll be doing differently in terms of this massive education and awareness campaign is that the intent of this survey is to identify the dynamics of, or the needs of each of the districts. So we are not going to do a generic PowerPoint presentation that we will deliver in each of the 7 health districts. We will make it suited especially for your district. So when these surveys come out, and we want to launch that by later this evening, so the surveys will come to you, we want you to do them so we can gather the information and prepare our presentation based on what is it you need. Thank you very much.
All right, do we have any other questions? No? Okay, so again, just to reiterate, we are going to have, as mentioned by Dr. Drago earlier, the importance of the media. You are the voice of the people, And you are responsible for bringing all what we do to the people. Without you, we cannot accomplish our goals. So thank you for your continued partnership. I want to thank all those of you listening and viewing. We want to thank our head table for making the time. All those of you who also braved the weather to come, the staff of the Ministry of Health, to join us this afternoon. We want to thank you for coming. And again, Caribbean Wellness Month in Dominica. Power.
I've been your presenter, Vanessa Bruno, taking you back to Master Control.